Plus, a free women's health event coming up, how you can sign up, and the warning signs you should be looking out for.
Welcome back, everyone. You know, we can all get caught up in our daily errands, jobs, families, but there's nothing that's more important, of course, than taking care of your health. That's why this morning we have Dr. Deborah Wilson here to talk about when you should get checked, why you should get checked. Thanks for being here this morning, first of all.
Excuse me?
Thanks for being here, first of all.
Yes, you're welcome. I'm glad to be here.
I just spoke really fast, maybe.
Yeah.
We're here to talk about an event that's going to be going on that you all, especially all the ladies, you'll want to get to in just a moment. But tell me about the wide range of women in your practice. You do OBGYN, and it's really important for women to realize what they should be getting checked out for when they come see their gynecologist.
Yes. Well, actually, we just do GYN at this point. Very important to have a yearly pelvic exam and breast exam, especially as we get older. As we get older, our risk of cancer goes up. So it's very important to have a yearly pelvic, breast exam, pap smear. The other thing that I feel is important, if you're over 50 and you still have a uterus and ovaries, to have a yearly pelvic ultrasound. Now, that's not widely accepted, but I'll tell you...
That's not a part of the regular screening after 50.
It's not, but we have picked up on cancers that way. Okay. So we encourage our patients, especially over 50, because, for instance, the peak incidence of ovarian cancer is 63. So as you approach 63, a yearly pelvic ultrasound is very helpful, and it can pick up early ovarian cancer, early uterine cancer, that sort of thing.
When we talk about what women should look for, aside from getting these screenings every year, there are some red flags that indicate, hey, you need to go see your doctor now if you have any of these things.
Definitely. The first thing is bleeding. Abnormal bleeding, you have to go into the doctor. So that means bleeding between periods. If you've been menopausal for, say, 3-4 years and all of a sudden you bleed, you got to get into the doctor, because that can be an early sign of uterine cancer.
Okay. How about abdominal pain?
Abdominal pain, again, now abdominal pain is difficult because many things can cause abdominal pain. But you want to go in, make sure, because that's often the first sign of ovarian cancer, the first sign of a uterus that's enlarging, or say increased abdominal girth. Say, you know, you haven't really gained weight, you're not eating more, you're not more sedentary, but all of a sudden your belly is increasing in girth. That's another reason to go in, because that's often the first sign of ovarian cancer.
Really? Okay,
yeah.
the bloating.
The bloating, yeah.
Okay. And then people may think of it as something else, but that's why you need to go see your professional doctor.
Yeah, and it's always, you know, what's there to lose? A little check, an ultrasound. You know, what's there to lose? The other thing we don't talk about often is lesions on the vulvar area. You know, a sore that doesn't go away, or a mark that wasn't there before, or a lump that you feel, you know, because vulvar cancer does exist, and it's important to check it out.
And you know what, I think a lot of people stay away from this topic. They're afraid to ask, they're afraid to mention, and it's something that you need to talk to your doctor about.
Absolutely, yeah, it's not dinner conversation.
No, not really, but it should be something you talk to your doctor about.
Yeah.
With that being said, so important that you guys are holding a free event today. Tell me about that.
Well, on Thursday night, Dr. Patak and I are holding an event. I'm going to be talking about menopause and sexuality. My partner, Dr. Kidd, is going to talk about women and testosterone. Condi Rogers, who works for us and does a weight loss clinic, is going to be talking about healthy you weight loss. Robin Perry, one of my nurse practitioners, will be talking about testosterone deficiency in men. So, and then Dr.
So it's not just for women, it's for everything.
It's for everything,
okay,
yeah.
Good.
Women will bring their partners.
And it's important to note that this is, you have to register before you guys come out there.
Yeah.
Okay.
And then, of course, Dr. Patak is going to talk about plastic surgery and non-surgical options for beautifying one's face and one's body. So, yeah.
Well, we'll put all the information on azfamily.com for this event going on again this coming Thursday. So,
thank you.
Dr. Wilson, thank you so much.
You're welcome.